My name's Ashley, and I chose the country Thailand.
My name's Cameron, and I chose the country Bahamas.
In Thailand, the total population is up to 69,799,978 persons, with an average life expectancy for women at 81.3 years and 74.2 years for men. The combined average for both sexes is 77.7 years. Thailand has become more urbanized at 51% compared to its rural areas, which is at 49%. The dominant ethnic groups in Thailand are those who are Thai, which is roughly 97.5% of the population, while 1.3% of the population is Burmese and 1.1% has unspecified their ethnic group. 94.6% of Thailand's population's religion preference is focused around Buddhism, while 4.3% are Muslim and roughly 1% are Christian. Here is a visual of where Thailand is located, and attached is a video talking about the elimination of mother-to-child transmission of HIV in Thailand. Although Thailand struggles with poverty, they are rising exceptionally with enrolling their younger generations into schooling. Thailand has multiple levels of education available for their younger generations, such as primary education, which is 6 years long, middle education, which is 3 years long, secondary education and vocational education, which is considered high school, and then tertiary education, which is considered college. Within their schooling, they are provided with HIV and sex education. Thailand also provides prevention programs to help educate people about how to prevent HIV. Thailand provides their people with mother-to-child transmission prevention and an overwhelming availability for condoms. On February 13th, Thailand celebrated International Condom Day to help promote awareness of being safe. Thailand is considered to have one of the highest prevalence rates within Asia and the Pacific, representing 9% of the region's total population of living with HIV and AIDS. Roughly 470,000 persons live with HIV and 5,400 new HIV infections as of 2019. At the start of this epidemic in Thailand, it began with people who inject drugs and share needles, which inevitably led to a spread within female sex workers and their clients. Recently, the most prominent way people are infected is through male-to-male sex, which is roughly 40% of the new infections each year. Other ways the virus is transmitted is through sex workers at 10%, transgender people at 11%, people who inject drugs at 20%, and migrant workers. As HIV and AIDS was spreading through female sex workers and their clients, condoms became a strong necessary item while having any forms of sexual intercourse. The AIDS-HIV epidemic in Thailand is addressed as a political priority. In order to eliminate mother-to-child transmission, Thailand needed to focus on those who are considered the hardest to reach, the poorest of the poor. As they were reaching this social class, their economic factors played a larger role as they had to invest more in the health care infrastructure. By reaching this social class and investing more money, Thailand proved to the rest of the world that by implementing important policies and attention, there are ways to facilitate the reduction of HIV from continuing to spread. This allowed hospitals to integrate measures that will closely monitor all pregnant women in the hospitals and provide early diagnosis and treatment for the mothers and infants. The political commitment that trickled through the country's social and economic roles allowed Thailand to eliminate MTCT transmission. For my major course of study, which is Health Studies with a focus in Healthcare Administration, professionals from this line of study may assist with the AIDS crisis by helping individuals find alternative ways to receive help from Thailand's healthcare plan. Through the administrative side of healthcare, it is important to ensure that all hospitals have the proper tools and equipment to lessen the numbers of those affected. Working with medical professionals and accommodating their needs will only help the fight of ending this epidemic.
The Bahamas has an estimated population of 389,482 people. An overwhelming majority of those who live in the Bahamas are of African descent. 90.6% of the population is black, whereas 4% of the population is white. 83% of people live in urban areas, whereas 17% of people live in rural areas. The native language that is spoken throughout the Bahamas is English, but due to the influx of Haitian immigrants, French or the Haitian dialect is also spoken. A majority of Bahamians are members of Christian churches, more specifically non-Anglican Protestants, but there are small proportions of people who are either Roman Catholics or Anglicans. Here is a visual of where my country is located, and attached is a link about the HIV prevalence in the Bahamas. Schooling is required by the law from age 5 to 16. The Bahamas has multiple levels of education available. Education is also free in the government-run schools. In 1974, the College of the Bahamas was established. This institution offers associate and bachelor's degrees in most areas of expertise. However, the opportunity for master's degrees are limited. The Bahamas is well known for its prevention of mother-to-child transmission program and was a regional best practice. As of December 2018, there were 6,025 people living with HIV in the Bahamas. This accounted for 1.5% of the population. There are 3 high-risk groups: young people, sex workers, and men who have sex with men. 65% of the HIV cases were male, whereas 35% were female. 21% of the new HIV cases were between the ages of 15 and 24. The younger generations are under the impression that they are invincible and that it cannot happen to them because they are young. In reality, they appear to be the age group most affected by HIV in the Bahamas. Once HIV was detected, the National HIV/AIDS Center in Nassau became in charge with being the national oversight for the Bahamas' response to HIV/AIDS. There are political, social, and economic issues that either facilitate or hinder the efforts to reduce the HIV burden. The primary goal for the Bahamas is to end the AIDS epidemic by 2030. One of the detrimental issues that the country faces is the struggle with money. There is an extremely uneven distribution of wealth, even though tourism brought improvements in everyday economic conditions for many Bahamians. The country also faces an even greater problem. HIV-infected people are not being upfront with their partners, and they are continuing sexual interactions while infected. This social issue could affect people in the long run because they could be spreading it without even realizing that they have it. Throughout the history of the epidemic, there have been important policies implemented in Bahamian society to bring attention to this fatal disease. The Ministry of Health in the Bahamas has played a crucial role in the progression by creating goals, visions, and treatment plans. My major is medical laboratory science. Professionals from my major course of study would be able to assist with the AIDS crisis in the Bahamas. My dream profession is to be a physician assistant. So a physician assistant would be able to help by examining patients, prescribing medicine, assisting physicians, ordering and assessing test results. Comparing our 2 countries, Bahamas and Thailand, we found multiple similar opportunities offered for those diagnosed with HIV. One similarity is that over half of the population of HIV-positive people are on antiretroviral treatments. Following those who are on these treatments, both countries have been able to suppress their viral loads at a significant rate. Even though these treatments are known to be pricey, both countries have implemented ways to help reduce the cost. Thailand has implemented this cost into the population's insurance schemes, and the Bahamas implemented it into their universal healthcare system, regardless of payment. Another similarity these countries share is that they have worked vigorously to eliminate transmission through mother to child, helping prevent HIV spread to infants and new generations.
Comparing our 2 countries, Bahamas and Thailand, we found multiple challenges they both face. One challenge is that the most prominent group for both countries affected are men who have sex with men and sex workers. For Thailand, over 40% of the population of men who have sex with men are affected with HIV each year. And for Bahamas, men who have sex with men is roughly 37% of the population of those who have HIV. For both countries, regarding sex workers, Bahamas is 23% of the population and Thailand is roughly 10% of the population. In both countries, poor people are at a disadvantage and struggle with fighting the battle of HIV. In the Bahamas, there is an uneven distribution of wealth. In Thailand, they have to reach the poorest of the poor to decrease the prevalence of those affected. Another challenge both countries face are with their young generations, as they are less likely to get tested because they believe they're either invincible or fearful of relaying the message to other personal relationships they may have or with their families if they test positive. These are the references we used on each slide.